Pregnancy scans are often the moment when pregnancy truly feels real. You walk into a quiet room, lie back, and watch the screen as a small moving shape appears. For many parents, this is the first time they see their baby and hear that reassuring heartbeat. It can bring excitement, relief, and sometimes anxiety. Beyond the emotion, pregnancy scans play a vital role in making sure both mother and baby are healthy throughout the journey. Today, we're breaking down pregnancy scans, what they are, why they matter, and how they help protect both mother and baby. If you value clear and reliable pregnancy information, give this video a like, subscribe to the channel, and join our growing community. Pregnancy scans are ultrasound examinations that allow healthcare providers to see inside the womb. They work by using sound waves to create images of the baby, rather than radiation. Because of this, ultrasound scans are painless and widely accepted as safe during pregnancy. Over the years, they have become an essential part of antenatal care, helping doctors and midwives monitor development and identify concerns early. The first scan most women have is the early pregnancy or dating scan, usually carried out between 6 and 10 weeks. This scan confirms that the pregnancy is developing in the correct place, checks whether there is one baby or more, and confirms the presence of a heartbeat. It is also used to accurately estimate the due date, which helps guide care throughout the rest of the pregnancy. For many parents, this scan turns uncertainty into reassurance. Between 11 and 14 weeks, some women are offered a nuchal translucency scan. This scan measures a small area of fluid at the back of the baby's neck. The measurement helps assess the likelihood of certain chromosomal conditions, including Down syndrome. There are two proteins in a mother's blood that we measure. PAPA, pregnancy-associated plasma protein A. BHCG, beta-human chorionic gonadotrophin. The levels can be assessed from a simple blood test taken from you either before or on the same day as the nuchal translucency ultrasound is performed. The results can be compared to the expected results in a pregnancy at the same gestational age. Simply by adding this blood test to the screening process, increases the detection rate from 80% up to 90%. This additional 10% detection means that half of the Down syndrome-affected pregnancies that are not being detected by your age. It is important to understand that this scan does not provide a diagnosis. Instead, it helps identify pregnancies that may need further testing. Parents are always given the choice to accept or decline this scan. At 13 weeks, the anatomy of your baby can be assessed in great detail. Technology has advanced significantly, and we can now recognize or suspect any structural abnormalities at 13 weeks. These checks are best identified via an internal ultrasound, ideally performed between 12 weeks 5 days and 13 weeks 2 days. We will also measure the uterine artery blood flow, combined with other maternal factors for a preeclampsia risk assessment. Preeclampsia is a disease affecting the health of both mother and baby. It is one of the primary reasons that you may need to deliver your baby earlier. During this scan, the insertion of the cord into the placenta is assessed, and the proportion of amniotic fluid to baby size is greater at this early stage, which allows for good visualization of the cord and therefore helps to detect if there is any variation from normal, which we can manage throughout pregnancy. We will also assess the ovaries. As pregnancy progresses and the womb fills the pelvis, the ovaries are repositioned and often impossible to locate with an ultrasound. The 13-week ultrasound is therefore an opportune time to perform an assessment of the ovaries. One of the most important scans in pregnancy is the anomaly scan, also known as the morphology scan, which is done between 18 and 22 weeks. This is a detailed examination of the baby's body. During this scan, the baby's brain, spine, heart, kidneys, limbs, and other organs are carefully checked. The position of the placenta and the amount of amniotic fluid are also assessed. This scan helps identify structural problems early, allowing care to be planned in advance if needed. As pregnancy progresses, some women may require additional scans known as growth scans. These are usually carried out in the 3rd trimester and focus on the baby's size, growth pattern, and position in the womb. Growth scans are especially important in pregnancies affected by conditions such as high blood pressure, diabetes in pregnancy, or multiple babies. They help healthcare providers decide the safest approach to delivery. A 3rd trimester ultrasound is a scan your doctor or midwife may recommend later in pregnancy, usually after 23 weeks. The timing of the scan depends on your individual care plan and is done to closely monitor your baby's health as you approach delivery. This scan may be advised if your baby appears smaller or larger than expected, if the baby is in a breech position, or if you have conditions such as gestational diabetes or high blood pressure. It is also commonly recommended for women identified as high risk for preeclampsia in earlier scans, as well as for those carrying twins or triplets. In addition, an ultrasound is important if you notice reduced or changed baby movements or experience any bleeding. During a third trimester ultrasound, your baby's growth is checked, the placenta assessed, and any findings from earlier scans are reviewed. The length of the cervix may also be measured to help assess the risk of preterm birth. The scan can estimate your baby's weight, although this is not exact and may vary by up to plus or minus 400 grams. If your baby is well positioned and there is enough amniotic fluid, 3D or 4D images may be possible. However, as the baby grows larger and fluid reduces, clear images can be harder to obtain at this stage of pregnancy. A common concern among expectant parents is whether pregnancy scans are safe. Ultrasound scans do not use radiation and are not known to cause harm to the mother or the baby when used appropriately. This is why they are routinely used worldwide as part of standard maternity care and are considered a reliable and trusted tool in pregnancy monitoring. Pregnancy scans are much more than images on a screen. They provide reassurance, guide medical care, and help detect potential problems early. They support healthier pregnancies and safer births, while also giving parents meaningful moments of connection with their unborn baby. From the first heartbeat to the final checks before delivery, pregnancy scans remain one of the most important tools in modern pregnancy care.